Vital Signs Part 2. Our respirations are triggered by three different mechanisms: increased levels of CO2, carbon dioxide, serum hydrogen ion concentration, or decreased levels of oxygen. Our carotid body receptors alter the rate and depth of respiration based on the carbon dioxide content of the blood. Oxygen and carbon dioxide are diffused across capillaries in the lungs to help maintain normal oxygen, carbon dioxide, and hydrogen levels. These are the organs of respiration. Upper respiratory is considered to be nasopharynx, the nose, the pharynx, the larynx, the trachea. Lower respiratory is going to be the lower trachea, bronchi, and the lungs. When you're assessing respirations, you need to make sure that the client does not know that you're actually doing a respiratory assessment. If you are counting respirations and they are aware of it, it will actually cause them to consciously or unconsciously alter their respiratory rate. So usually we count respirations at the same time we're doing a pulse rate without them being aware that we're making that change. You count for 1 full minute if the respiratory rate is irregular or if it is a pediatric client, as pediatric clients frequently will have irregular respiratory rates. Otherwise, you can count for 30 seconds and multiply by 2. Decreased oxygen levels and or increased levels of carbon dioxide can increase the rate. Definitions of these respiratory patterns: eupnea is a normal, relaxed pattern. Dyspnea is difficult and labored breathing. Tachypnea is increased or rapid rate. Bradyapnea is a decreased or slow rate, and it can also be shallow. Apnea is a lack of respirations. Hyperventilation is increased rate and depth of breaths. Cheyne-Stokes is dyspnea followed by a short period of apnea. Kussmaul's is an increased rate and depth with panting and long grunting exhalation. And Biot's is shallow for 2 to 3 breaths with a period of variable apnea. Lung sounds vary. You can have no lung sounds other than just your normal respiratory sounds. You can have adventitious sounds such as crackles, which are non-musical crackling sounds heard during inspiration, and they are usually not cleared with coughing. Rhonchi is a continuous dry rattling sound caused by partial obstruction. Stertor is snoring sound when the client is unable to cough up secretions. Stridor is a crowing sound on inspiration, and that's caused by obstruction of the upper airway passages. You see that frequently with croup or laryngitis. Wheezing is a whistling sound or air forced past a partial obstruction. And pleural rub is a grating sound heard during inspiration and expiration. When you're checking a pulse oximetry reading, a sensor or probe is attached to the client. Within that probe, there's an infrared and red light that reaches the capillary bed. You can place these probes on the finger, the toe, the ear, and the forehead. If you obtain a reading that is outside normal, check your client. Review these factors that can affect the reading and try another site. Always make sure that you reassess if you get an incorrect or low pulse oximetry reading. Blood pressure is affected by condition of the vascular bed, circulating blood volume, and cardiac output. Blood pressure does change with aging, and that's normal. If blood pressure decreases beyond the vascular bed's ability to compensate, the blood pressure can decrease. We often see this in dehydration and hemorrhage. Vasoconstriction elevates the blood pressure by diverting circulating blood volume away from the periphery and the non-vital organs to the vital organs, the heart, lungs, and brain. In other words, when we're vasoconstricted, blood is diverted from our legs and our arms, the bladder, the stomach, etc., to those vital organs, the heart, the lungs, and the brain. Vasodilation decreases blood pressure. If you think about it for a minute, vasoconstriction should increase blood pressure because the diameter of the blood vessel that the blood is being pushed through is going to be smaller, and it's going to take more force to push the blood through that smaller space. On the flip side, with vasodilation, where the blood vessel is bigger, it's dilated, it doesn't take as much force, there's more room for the blood to go through, so the blood pressure will drop. Different factors that can affect blood pressure will be your age, gender, ethnicity, stress, medications, activity, weight, smoking. Smoking increases blood pressure. Daily variations, cuff size and placement, and the position of the extremity the blood pressure is being checked on. You should always take the blood pressure with the client in the same position, in the same extremity, and use the same size cuff if you want the most accurate comparisons. Make sure that you are aware of these definitions of blood pressure: prehypertensive, stage 1 and stage 2 hypertension. When you're listening for the blood pressure, the sounds that you're hearing are called Korsakoff sounds. You may only hear beginning and ending sounds in some clients, but you may distinctly hear all sounds in other clients. Abnormal blood pressure readings would be hypertension, which is elevated, and hypotension, which is low. You also may see postural and orthostatic hypotension, where the blood pressure is low only if they're in a certain position or if they go from a lying to a standing position. This is a drop in blood pressure that occurs with a change from lying to standing or sitting to standing. And we also have to assess pain. It is the fifth vital sign, and it has to be assessed on every patient. Make sure again that you use the same pain scale for every patient. Let me back up. Use the same pain scale on the same patient every time you're assessing the pain if you want an accurate comparison as to how their pain is. Assessment of pain should include location, intensity, character, frequency, duration, and anything that improves or worsens the pain, and radiation. Does it stay in the same place or does it move around? Assessment frequency should be at least as often as the other vital signs, and more frequently if you're treating the pain or if they're complaining of pain. Documenting vital signs. The temperature is going to be recorded in even numbers unless you have used an electronic or digital thermometer. And always document the method of measurement. As I was instructing previously, when you take a temperature, you do not make any adjustments in the reading to make it equal to an oral temperature. You simply document where or how the temperature was taken. And blood pressure recordings our readings are going to be recorded with the systolic pressure over the diastolic pressure.